Welcome to StudyNeuro, your go-to hub for high-yield neuroscience education and practical clinical pearls. You can follow us on YouTube at StudyNeuro, on Facebook at StudyNeuro, TikTok and Instagram at @StudyNeuroOfficial, and on X at @StudyNeuro2025. Today, we're exploring a critical laboratory pitfall in hyperprolactinemia, the hook effect. By the end of this session, you'll have a clear understanding of how prolactin is measured using sandwich immunoassays, why this unique mechanism can lead to falsely low readings, and when you should suspect it in your patients. You'll also learn the corrective steps to reveal the true prolactin levels and appreciate the real clinical consequences if this phenomenon is overlooked. Understanding the hook effect is essential because even a giant prolactinoma can appear deceptively mild in the lab. Recognizing this artifact ensures accurate diagnosis, guides appropriate therapy, and prevents unnecessary interventions. So, let's dive in and explore how to detect and manage this high-yield diagnostic challenge in hyperprolactinemia. Accurate measurement of serum prolactin is crucial in the evaluation of hyperprolactinemia. Prolactin levels serve as the central discriminator in these disorders, helping clinicians determine the underlying cause, guide the appropriate treatment strategy, decide between surgical or medical management, and anticipate prognosis. Laboratory artifacts such as assay interference or the hook effect can significantly alter prolactin readings, which may mislead clinical decisions. Therefore, precision in measurement directly impacts patient outcomes. The magnitude of prolactin elevation also provides important diagnostic clues. Levels below 100 nanograms per milliliter are usually due to stress, physiologic factors, or medications. Levels between 50 and 125 nanograms per milliliter may suggest hypothyroidism or a stock effect. Macroprolactinomas, typically under 10 millimeters in size, often produce prolactin levels between 100 and 250 nanograms per milliliter. Macroprolactinomas usually elevate prolactin above 250 nanograms per milliliter, and in cases where the tumor invades the cavernous sinus, levels can exceed 1,000 nanograms per milliliter. Understanding these distinctions ensures that clinicians interpret prolactin values correctly, avoid misdiagnosis, and provide precise, effective patient care. Let's review how normal prolactin measurement works. Most laboratories use a sandwich immunoassay to determine serum prolactin levels. In this method, a capture antibody first binds to prolactin in the sample. Then, a detection antibody attaches to a different site on the prolactin molecule, forming a stable sandwich complex. The assay measures the signal intensity, which is directly proportional to the amount of prolactin present. Under normal conditions, this system works predictably. The higher the prolactin concentration, the stronger the signal, allowing accurate measurement of serum prolactin levels. The hook effect is a laboratory artifact that can occur in sandwich immunoassays, particularly when prolactin levels are extremely high. In this scenario, an excess of prolactin saturates the capture and detection antibodies, preventing proper formation of the sandwich complex. As a result, the assay reports a falsely low or only moderately elevated prolactin level, even though the true serum prolactin is very high. The core concept is simple, but critical. A giant prolactinoma may appear biochemically mild if the hook effect is not recognized, which can lead to misdiagnosis and inappropriate management. When prolactin levels become extremely high, the sandwich immunoassay used to measure it can actually be tricked. Both the capture and detection antibodies become overwhelmed, and the assay fails to form the proper sandwich complex. This leads to a weak signal, so the lab reports a prolactin level that looks only moderately elevated. Essentially, the patient may have a very high prolactin, but the test underestimates it, which is exactly why the hook effect is so important to recognize in clinical practice. You should suspect the hook effect when there's a mismatch between the size of a pituitary tumor and the prolactin level. Key clinical clues include a large tumor, typically over 3 centimeters, but with only a mild or moderate elevation of prolactin. In other words, if the tumor appears much bigger than the hormone level would suggest, that's a red flag. Whenever you see a large macroadenoma with a deceptively modest prolactin, the hook effect should be strongly considered, prompting further testing to uncover the true hormone level. The clinical importance of recognizing the hook effect cannot be overstated. When this laboratory artifact goes unrecognized, a true macroprolactinoma may be misclassified as a non-functioning pituitary adenoma. This misclassification can lead to unnecessary surgical referral and a delay in initiating dopamine agonist therapy. As a result, patients may experience avoidable morbidity from inappropriate management of what is, in most cases, a medically treatable condition. Accurate identification of a macroprolactinoma has major therapeutic implications. Dopamine agonists are the first-line treatment and often result in marked tumor shrinkage with restoration of gonadal function, allowing many patients to avoid surgery altogether. In contrast, failure to recognize the hook effect can divert the patient down an entirely different and incorrect management pathway, exposing them to unnecessary surgery or delaying effective medical therapy. Recognizing this diagnostic pitfall ensures the right treatment is given at the right time and prevents a fully avoidable clinical error. To confirm the presence of the hook effect, the recommended approach is to perform a serial dilution of the patient's serum, for example, a 1:100 dilution. The prolactin level is then reassayed, which allows the true hormone concentration to become evident. This simple step helps prevent misdiagnosis and ensures that treatment decisions are based on the patient's actual prolactin level. In conclusion, the hook effect occurs when extremely high prolactin levels saturate assay antibodies, leading to falsely low or deceptively modest readings. Clinicians should suspect it in large pituitary tumors, where the hormone level seems disproportionately low, and always investigate any mismatch between clinical findings and biochemical results. Precision in measurement is critical. Accurate labs lead to accurate care. Join the StudyNeuro community for high-yield neuroscience education and clinical pearls on YouTube, Facebook, TikTok, Instagram, and X. Don't forget to like, comment, share, and subscribe. Thanks for watching, and stay tuned for more.